All right, guys, let's try this one more time. All right, can everyone see that? Okay, beautiful. So as I was saying, we're gonna have this set up on the computer right in front of the drug box in ICU. Carrie, I'm recording this, so I'll send you the recording after since you can't see my screen, but so we're going to have this set up on the computer in ICU in front of the drug box so that when you print your CRI sheet, it will also print a sticker label that can be the label that we would normally put on the syringe or on the bag when we make one of these CRIs. So coming up here soon as Jeff and I get that done, we won't have to write out that orange sticker for CRIs or anything that we make. So it'll make that process a little more seamless and hopefully save you guys, a few minutes worth of time not having to write that out. So as soon as Jeff and I get that accomplished, we will let everyone know. But again, I just want to make sure that you guys are familiar with the CRI and kind of have a quick intro on how to use it. So again, it is the CRI for ICU use. It's on most of the computers down there in the ICU. And Dr. Light has put a lot of time into this. It's actually really nice. It can do a lot for us and shows us essentially, all the information we need when we are making one of these CRIs. So as you see here, you can start off with a CRI of just one medication. You can do a CRI of two medications, or we have our electrolyte calculator over there as well. And so for this example, I'm just going to pick the CRI 1 med, and this is what you will see. So we have our boxes for patient name, owner last name, patient weight. As far as actually making the CRI calculator work, the patient weight box is the only one that matters for getting your calculations, obviously. But we do, need to fill in all of this information. So we're going to say we have a 35 kg dog, and then each CRI is going to start off with do you want to set up by hours or total volume? So you can do it, if you want to make your CRI into a 60 ml syringe, you could put that as total volume here, and it'll give you the amount of mils you can put in, or if you want to do it by hours, that is also what will populate. So for this example, we'll do hours. We'll say we're going to do 12 hours worth of the CRI here. And then for your medication, you just come to the drop down here. She pretty much has every medication that we would do a CRI with in here. And if there's anything that we don't have, or, you guys feel would be useful to be in here, any particular drug combinations, anything like that, you can let us know, let Dr. Light know. She is the one who's coded all of this, so she can make any adjustments we feel would be most beneficial, to you guys on the floor and to the doctors. So for this example, we're just going to go with fentanyl. And as you saw, when I selected fentanyl, that made a bunch of changes to all of the information down here. It'll do that for each drug, depending on its, normal stock concentration. And so when you go to this, you do just want to make sure that your stock concentration is what it shows here. So our fentanyl is the 50 mic per mil, and we're going to go with our mic per kg per hour for the fentanyl. And so it gives you the option. Do you want to do a loading dose? You just say yes or no. We're going to say no, but if we did want to, you can say yes, and it will give you the information here. So, if we were going to put in our loading dose, we could add it into there, but we're not going to do that with the fentanyl. We're going to start our rate at the 3 mics per kg per hour. So you just enter that in there, and based off our patient's weight and everything we've put in, our parameters, medication running straight is going to be 2.1 mils per hour for that 3 mic per kg per hour. You can say, do you want to dilute it? Yes. Do you want to not dilute it? We're not going to dilute it. But if you were going to dilute it, it changes this box here to what do you want your fluid rate to be? So say this was one of those teeny tiny dogs, that their fentanyl, normal 3 mic per kg per hour fentanyl rate would be 0.2 mils or something like that. And the doctor does request that you dilute it, which we're all kind of talking about as to whether that is necessary or not, but say that were the case. I know Dr. Light doesn't like the CRI rates to be less than 1 mil per hour, but you could come in here, say you wanted it at 5 mils per hour. And so it's going to make us a total of 60 mils. And then if we go over to the patient print sheet and scroll up, it's going to show us our CRI information here. So you can see, because we wanted to dilute it, that it wants us to add 25.2 mils of fentanyl to the 34.8 mils of whatever crystalloid, saline, norma, or whatever it may be. And that will give us our 60 mils to run at the 5 mils an hour. So this is how most any of these will work. If I said, no, I don't want to dilute it, you want to, in here, put in the rate that is shown up here. So this medication will run straight at 2.1 mils per hour. So if you're not diluting it, you need to come down here and enter that rate that it has calculated for you above. And then you can go back to your patient print sheet, and it will show our undiluted mixture here. So essentially it's that 25.2 mils of fentanyl is going to give us our 12-hour supply at the 3 mic per kg per hour rate. And so this is what it'll look like when you print out, very similar to any of our other CRI calculators. But a couple of changes we have made are that one, it is printed, you need to write your name here, that you're the one who set it up. You need to write or have whoever checked your CRI written here. That is one thing that we are asking that you guys do anytime you make a CRI. Just have another technician, doc, whoever's around, take a quick peek at it and say, okay, yep, you put your numbers in, that all looks good. And then also initial on the sheet if it has been charged and if it has been logged out of the drug box, if it is a controlled drug. So just a couple things that's going to make it easier for everyone to make sure that all these steps, boxes have been checked essentially. And as I said, once Jeff and I get the setup there at that computer in ICU, this information will print on a sticker. We're going to work on having it really be the essential information, everything we can fit on a sticker that will reasonably fit on our 60 mil syringes at the smallest, and then of course on a fluid bag and things like that. So that's just a quick basic overview of that. Does anybody have any questions about our plan? I know once we get this completely rolling and everyone knows how to use it, we will probably go and remove the other CRI calculators that are around on the various computers, so that we are consistently just using this one. And for those of you that popped on a little bit later, I did mention that when a patient comes out of surgery, surgery is going to continue using their CRI calculators. Theirs are a little bit different and they're a pretty well-oiled machine. So what'll happen is if they bring a patient out of surgery, say on fentanyl, they are going to keep their fentanyl CRI. They have prepared their CRI sheet. And once that syringe has finished, is empty, and you have to refill it, then if this was your patient, you would remake a new fentanyl sheet using this calculator. Yes, Carrie, we we will. It is available on a lot of the other ICU computers. I think it does also live on the T drive, but if you guys have particular ones that you would like it on elsewhere, just shoot me an email and let me know. The only computer that will have the sticker option for printing the sticker, at least right now, is only going to be that computer under the drug box in the ICU. If it's relatively easy for us to set up so that you can print the sticker from other computers, we will. But for right now, it will just be on that computer once we get it going. And I will send out an email as soon as that sticker is available to print. But for now, you'll just print your CRI sheet here as you normally would, and put it with the CRI, and then label your syringe or your fluid bag with one of the orange stickers that we've already been using, where you just have to write in the information. Okay, perfect. Thanks, Rob. Anyone else have questions? Okay. All right. Well, thanks guys for jumping on with me. If you have any questions, let myself know, Ambria, anyone, and we'll have our couple more trainings the rest of the week. And then our plan is that this will be rolled out, and this is the only CRI calculator we will be using by next week. So again, anyone, questions, concerns, please let us know. Otherwise, everybody have a good rest of your day. Thank you.